Good afternoon, everyone, and good afternoon, Katie. Thank you very much. Again, good afternoon, everyone, and thank you for joining us today for this webinar. We really appreciate you all coming out. Thank you for joining us in discussion on the Community Services Block Grant Project Impact Rapid Cycle Projects, where we will discuss our use of Rapid Cycle Learning, or RCL, to support and enhance local projects. My name is Renika Carr, and I am the project manager for Project Impact, and I am from the Office of Community Service in the Division of Community Assistance, which is the home of CSBG. It is my pleasure to be here with you today for this peer-to-peer exchange opportunity that will include grant recipients presenting their project impact projects for you, and for you to hear from them about their experiences, accomplishments, and findings using RCL techniques. This convening will also provide an opportunity for you to ask questions about what you've heard. Presenting today, we have my fellow OCS colleagues, our Project Impact Technical Assistance Support Team, Mathematica, and of course, the Project Impact Grant recipients. Next slide. To support a smooth meeting, which involves us being respectful of our colleagues, here are a few housekeeping tips. During this meeting, please keep yourself on mute unless you are speaking. Also, please keep your video on if you are speaking. If you have a question for the presenters while they are speaking, please write your questions in the chat box. To access the chat, click the chat button on the bottom right of your WebEx window. And lastly, for presenters, to help us stay on schedule, we will send reminders in the chat box. Next slide. On the agenda, you will hear remarks from the Director of OCS, Dr. Laniqua Howard, who will be introduced by the Director of Division of Community Assistance, Sharice Johnson. This will be followed by comments from myself and Rachel Alcott, who will be sharing with you what Project Impact is and how we are using rapid cycle learning to support innovative projects. And most importantly, we will have presentations from the Project Impact Grant recipients and a question and answer opportunity after each group's presentation. Next slide. I will now pass the mic over to Sharice Johnson, who will introduce the OCS Director. Sharice.
Good afternoon, Project Impact Grant recipients, CSBG Network, DCA staff members, as well as OCS. I'm Sharice Johnson, Division Director for the Division of Community Assistance, where CSBG is implemented. Our CSBG is, we provide oversight to CSBG. And I, on behalf of Dr. Laniqua Howard, want to say welcome to this session and thank you, CSBG Project Impact Grant recipients, for your work. Dr. Howard cannot be with us for the beginning of the meeting. She has been called to meet with the president to talk about issues that concern many of us. However, her goal, if possible, is to join the meeting toward the end, and if she's able to, she'll be able to give some closing remarks. Dr. Howard has been a supporter of this work. She regrets that she wasn't able to attend. She asked me, were we going to record this so that she could listen to all of the grant recipients as they talk about their remarkable work. I also want to say that Janelle George, the Deputy Director for the Office of Community Services, is also a big supporter of this work, has followed this work since its inception. She too will plan to join at the end of the session to learn more about this work. And of course, everyone will listen to the recording once it's available. So I just want to say that the Office of Community Services, the Division of Community Assistance, we're excited about this work, and we know that you've done you're doing very important work at the community level in order to bring about change. But I want to talk a little bit about how this came to be. In 2020, you all know that the Office of Community Services received $1 billion to respond to prepare for, and to prevent COVID-19 or the spread of COVID-19. CSBG states, eligible entities, state associations, territories, and tribes, and the TA network responded to be able to meet the needs of communities and to support individuals, families, and communities during the pandemic. Of course, the families that were supported were families that were in most need. And I have to say that our eligible entities, along with all of our partners, did this remarkable work during 2020 while taking care of themselves, taking care of their families, and also staff. And for all of that, we have to say thank you. In 2021, OCS started to hear more about the outstanding community level work, and we wanted to learn more. I was joined by Steph Hassett, Andrew Colley, and Kim Klum from OPRE to think about how can we learn more, how can we develop a body of knowledge that we would like to share throughout the network, and at the same time figure out things that happened during this time of having to be quick to adapt to meet the needs of communities. How could we really learn from that and be able to share that with all of you on this call today? Using rapid cycle learning was the approach that we were introduced to from OPRE as one strategy to think about how do we learn about implementation, what works with projects, and how can we get projects to really meet their outcomes. And you're going to learn more about rapid cycle learning as we move forward. But since then, the remarkable work led by Ronika Carr, Katie Eden and her mathematical colleagues, as well as Sharice Evans from OPRE, you're going to get this showcase. Our grant recipients have been committed to this process. They've actually told us about how meaningful this was to them in thinking about their projects and thinking about the work that they do at community level. So we know that it has been a win for all. We thank all of the 16 grant recipients for being committed to trying to build knowledge not only in their communities and their in the services that they provide, but changing their organizations to be able to really develop programs and activities that really can have an impact on individuals and families long term. The Office of Community Services and CSBG is all about moving families beyond their crisis, and I think you will hear during these presentations today just how communities have been responsive, have allowed communities to become healthier as a result of the impact of the pandemic. And I don't want to talk too much longer, but I'm so excited to share with you all what they have been able to do to facilitate change and to transform communities. So without delay, I'm going to turn it back to Ronika Carr, who's going to lead the conversation along with the colleagues from Mathematica and others in regards to the remarkable work that has happened. Ronika?
Thank you, Sharice. So next slide, please. So Sharice gave a very thorough overview of CSBG Rapid Cycle Project, so I don't necessarily need to go a lot into details regarding that again. And so again, in 2021, of course, we published a funded opportunity announcement where we awarded grants to grant recipients to be able to use RCL approaches to strengthen their implementation and effectiveness of service models. And so again, this project is a 15-month project. It started in fiscal year last year and it ends in December. Next slide, please. So here we see on the slide, we have 16 grant recipients. And so you're able to see who the 16 grant recipients are. And so these grant recipients are 60 nonprofit agencies that is made up of community action agencies, one state association, as well as 2 nonprofit organizations that were not previously part of CSBG network. So that is a unique effort for us. The projects from these agencies address one or more of the 5 focus areas that OCS had identified in the funding opportunity announcement. And so this includes adapting service delivery to a physical distancing environment. It includes identifying and training for high demand jobs or strengthening individual and family adaptive capacities. And so these agencies have provided much needed and welcome services in their communities during the pandemic. And the service includes food delivery, job training, mental health services, as well as services to support families using 2-generation approach. Here we see a list of the 16 grant recipients and their focus areas. But one thing to note is that for some of the recipients' focus areas, they focus on multiple priority areas. For the purpose of this graphic, we only identified one, which is their primary focus area. Next slide, please. So Sharice also mentioned some of this in her talking points as well. And so, OCS's vision for Project Impact using rapid cycle learning techniques in CSBG is multifold, and it looks at both immediate as well as long-term benefits. What OCS is trying to do is for grant recipients to be able to build their RCL capacity, as she previously mentioned. We also want the grant recipients to be able to gain knowledge from the work that they're doing, to be able to use it long term in their projects, in their programs. We also want to be able to demonstrate the significance of innovation and collaboration in CSBG. And so this is a unique project for us. It's a first time project for us because we want to show that we can revolutionize our way of thinking, our training technical assistance, and our partnerships to come up with conventional ways to support our grant recipients. And you will learn more about that today as you hear from the 16 recipients and how RCL impacted the implementation of their service model. And additionally, this project and the information that the recipients receive is permanent. And even after this project ends, they will be able to access information. They will have the knowledge with them to support their efforts for continuous improvement within their projects and programs. And lastly, as Sharice also mentioned, we want to develop promising practices so that we can build knowledge into CSBG network and to be able to support CAAs and nonprofit organizations to strengthen and enhance programs to effectively respond to current community needs and future disasters, and to support the needs in communities impacted by low incomes. Next slide, please. I will now pass the mic to Rachel Ockett. Rachel is one of our technical assistance providers for Rapid Cycle Learning, and she provides a wealth of information, resources, and coaching to grant recipients, along with other staff from Mathematica. She will provide an overview of Rapid Cycle Learning and why it matters to OCS that CAAs have to have and use this approach to improve their service delivery. Rachel?
Thank you so much, Renika. I'm so delighted to get to speak to all of you about rapid cycle learning, my favorite thing. So as Renika mentioned, I'm part of the Mathematica team that has been working with the Project Impact Grant recipients. Over the course of this grant period, we've been providing technical assistance to all of these wonderful organizations through individual coaching, group convenings, and by sharing a library of tools and resources related to RCL. So today, next slide, please. We're going to, in this brief presentation, we're going to get ready to hear more from our grant recipients about the work they've been doing by offering a little bit of background on rapid cycle learning. So we'll talk about what it is, why it matters, and we'll also talk about how it relates to Roma. Next slide, please. Okay, so what is rapid cycle learning? Next slide. When we think of research, I think what comes to mind for a lot of us is something dense, time-consuming, not relatable, right? Not applicable to our lives. But next slide, please. It can be different, right? Research can be accessible and it can even be fun. Learning quickly and making changes based on what you've learned helps everyone feel more successful, which can keep the momentum going for further growth and improvement. Next slide, please. So rapid cycle learning is a framework or a set of methods that organizations can use to quickly learn about and improve their programs. So rapid cycle learning focuses on rapid program improvement. It's short term. It works in a cycle. You try out a new strategy, a new tool, a process, etc. Test it with your team and your participants, refine your strategy based on what you learned, and test again. What makes rapid cycle learning a little different from just collecting data is that it's more intentional and systematic. So it uses research methods to distill the most useful lessons learned from the data you collect so you can make the best decisions. Next slide, please. So in practice, you might be wondering, how is rapid cycle learning different from business as usual? I can tell you, when I was a nonprofit director, I was often caught in compliance mind, right? I was collecting the data my funders asked for, but not always thinking about what it meant or how I might use it. With rapid cycle learning, I learned to do a few things differently. I started to look a little more closely at the data I was collecting to make sure it was measuring the things that really mattered. I started reviewing data on an ongoing basis rather than waiting until it was time to report. And especially, I started thinking beyond outcome data, right? Like thinking not just about how participants' lives changed as the result of our program, but about our day-to-day program operations to understand what we could tweak in the way we were implementing our work to make things better. Um, so next slide, please. So this is really why rapid cycle learning can be so useful for organizations, right? It can help reduce that change fatigue we feel by creating a space to try and refine a strategy on a small scale and then tweak it or abandon it, adjust it, right? Before fully leaning into something to make sure we're going in the right direction. This is a process that really promotes buy-in among staff and participants because their voices are at the center. They're the guideposts, the direction you ultimately go. And then by collecting feedback and analyzing it quickly, we can really improve the implementation of a strategy and how it fits in the environment that we're in. But we know that the more time you spend on something, the more attached you can get to it and the harder it is to change. And this is where rapid cycle learning is really helpful. You can test and make changes as you go and then end up with more sustainable practices in the long run. You can even think about RCL as like a philosophy that can guide your organization, right? Organizations are the most successful when they get really good at using data to make smart decisions, quickly figuring out what's working, what isn't, and what they might do differently. Next slide, please. All right, so let's talk a little bit about how rapid cycle learning works. Next slide, please. So you might be pretty familiar with this already. If you have experience with Plan, Do, Study, Act or road testing, um, you have experience with rapid cycle learning. Um, so we use several different learning methods in RCL to do different kinds of things. If we're trying to learn about how user-friendly or doable a strategy is, we might gather information using PDSA cycles, road tests, case studies. If we're trying to see if a new strategy is moving our outcomes in the right direction, we might use an outcomes or a KPI analysis. If we're trying to determine if a strategy is effective, we might do something like a rapid cycle experiment or an opportunistic experiment. Next slide, please. Okay, so regardless of what method we're using, there's some common key steps in RCL. So we start by identifying a problem or a challenge to focus on, and then we brainstorm possible solutions to that challenge and choose a strategy that we want to try. Could we advance the slide, please? Thank you. Yeah. So then we can propose a learning question about that strategy and then design a test to investigate it. And this is the fun part. So testing your solution. We try it out, we gather information about how it's working. Then we learn from our data. What happened? What does it mean? And finally, we make decisions based on those data. So we refine our strategy, try again, keep it as is, go back to the drawing board, and we'll hear examples of all these kinds of decisions when we hear from our grant recipients shortly. Next slide, please. So a couple kind of key things to keep in mind when we're thinking about rapid cycle learning. Small is big, right? There's a lot of pressure to measure and demonstrate outcomes, but you'll get more long-term bang for your buck if you focus on questions related to implementation first. Things like who's engaged in our program, who isn't, how are staff delivering services, what's getting in their way. You want to evaluate your best possible program. So it really pays off to spend some time making sure that your foundation is solid before getting into outcome questions. Next slide, please. Okay, so let's talk briefly about how rapid cycle learning relates to Roma. Next slide, thank you. So thanks to Community Action Partnership for this graphic. You all are probably familiar with ROMA, or results-oriented management and accountability. You know that ROMA is all about using data to make better decisions. And the ROMA cycle, like the rapid cycle learning cycle we just took a look at, has 5 steps, starting with assessment, right? What does data tell us about what our community needs? Planning, using that data to identify outcomes and strategies, implementation to execute strategies, achieving results, collecting data, measuring progress, and then evaluation, right? Analyzing our data to compare to benchmarks. Could we advance the slide, please? We like to think of rapid cycle learning as a small wheel that can help move the big wheel of Roma along. So rapid cycle learning, as we've just discussed, is especially helpful for implementation. You want to evaluate your best possible program. So as you can use rapid cycle learning to test out an implementation strategy, gather data on how it works, make tweaks until it's working, until it's being implemented in the best possible way. But you can also use rapid cycle learning to refine or inform other Roma steps, right? So you could use it to test out different ways of collecting data or reporting progress, or you could use RCL principles to analyze data as well, reviewing data together, weaving it into team meetings, etc. The main point here is that rapid cycle learning doesn't replace or conflict with Roma, but supports it, right? A team that gets really good at rapid cycle learning and using rapid cycle learning consistently, that is testing and perfecting new strategies and processes, reviewing data as a team, using data to make decisions, is a team that can get the most out of Roma. Next slide, please. Okay. So a couple key takeaways before we jump into our presentations. Rapid cycle learning offers a set of methods organizations can use to test and improve strategies quickly. It helps reduce change fatigue, promote buy-in, and improve implementation. And you can think about it as a small wheel that can help move the big wheel of Roma along the path to continuous program improvement. So we'd like to invite everyone here to listen for these themes as the grant recipients share with us about their work, and chime in with your questions in the chat. Please feel free. So next slide, please. Without further ado, we'd like to hear from the Project Impact grant recipients about their experience using rapid cycle learning in their projects. So here's how the presentations will work. Grant recipients are going to present in groups of 4, and each group is going to focus on a specific topic related to the strategies that they tested. So each grant recipient will have 5 minutes to present. They'll introduce themselves and their organizations, and then they'll present virtual posters about how they used rapid cycle learning in their projects, what they learned, and then suggestions for other people who might be curious to try some of these things out themselves. After each group of 4, we'll have a 3-minute Q&A. But as our grant recipients are presenting, please feel free to ask questions in the chat. Even if we can't get to your questions verbally during the Q&A, we can try to respond in the chat. So let's get to it. Our first group is a project delivery group. So first, we're going to hear from the Regents of the University of Minnesota.
Hi, my name is Rachel Schulman. I am from the University of Minnesota Center for Public Health Systems. And what we tested was an aspect of our student internship program that we implemented with local health departments. So we placed 10 students with local health departments over the summer in hopes of achieving a couple of aims. The first was to help the students at the university who are students in public health just get some meaningful work experience in public health practice and understand what working in the local health department means. They worked on projects ranging from supporting communities experiencing food insecurity to starting a public health ethics committee within a health department, to analyzing population data in ways that help the health department better serve the community. But the program really also benefited the health departments as well. A lot of them are experiencing capacity issues, both in the short and long term, related to their staff and workforce. So the project helped them increase their capacity short term to do some critical projects that their staff didn't have time to do, and hopefully addresses staffing shortages in the long term by introducing young people to potential governmental public health job career paths. So one of the strategies that we tested was an onboarding process for the local health departments that were hosting the student interns and the students as well. So we conducted virtual orientations with the students and their site preceptors together. And then about a month later, we conducted a survey of the students in the host site separately to ask them about both the application process and the orientation processes. So we did that online over email. We learned a couple of things. We definitely learned that the program was already helping to increase health department capacity, getting some really critical work done. We also learned that the health departments needed assistance during the application process, identifying well-defined, like meaningful projects for the student interns, and that really having a project that was well-defined from the outset was really critical for student success. And we also learned that the application process should have been longer and kind of ordered a little differently, that we should be developing the projects with the local health departments first, and then having students apply to specific projects and kind of doing everything a little bit earlier to give students plenty of time to make their summer employment decisions. So based on the evidence from those surveys, we were able to share a lot of really critical information with some of our partners at the University of Minnesota. We do not have funding to continue this project right now, but at the School of Public Health, we have others who are implementing similar student placement programs with local health departments. So we were able to share all this information with them so that they could use it, and they already used it to kind of help develop the projects and change the timelines. And with great success. So I would say that the project impact really added value to our organization because we were able to pilot this program in ways that will really continue to serve students for a long time to come and give them opportunities for practice-based experiences. And we also at our center now have a template. So when we get funding for future practice-based projects, we can use the resources from this experience to conduct rapid cycle learning evaluations for future programs. In terms of what we would recommend to others interested in using this process, definitely if you're going to do multiple rounds of evaluation, identifying specific dates and points in the project for conducting evaluations to make sure they don't kind of sneak up on you and give you time to develop really good evaluation questions. And also then budgeting the staff time and resources. So if you learn, you're going to learn information during those evaluations that you're going to want to follow up on, and making sure that you just have the time and resources set aside to like act on that information and make those changes. I am in the airport right now, and so it's probably better for those of you who have questions to put them in the chat rather than wait till the end of the presentations. Thank you.
Thank you, Rachel. Wonderful to hear about your project. Okay, Metro Action Commission. We've got Angelique and Tanya.
Good afternoon. My name is Angelique Stamps. I'm with Metropolitan Action Commission based out of Nashville, Tennessee, here in Davidson County. I am the Workforce Services Coordinator. What our focus is on was career training, more specifically for CompTIA. CompTIA, just a short overview, it's the starting point for careers in IT. They support basically today's core technology from security to hardware. And the focus is really on 9 skills, which is a range of hardware, operating systems, software troubleshooting, networking, and so on. And coupled with that is an exam, which is a series of 2 exams, which we call Core 1 and Core 2. So what our improvement strategy, what we decided to test on was incorporating tutoring into our program prior to our students taking the CompTIA exam. So some of the things that we thought would be a great idea to analyze or to collect our analytical information was through a series of surveys. And those surveys comprised of student surveys, because we wanted to know what their classroom experience was like, as well as what their satisfaction was with the training, with the instructors, with the material that they received. We also wanted to do a one-on-one. We found that when we did the survey was a little too broad because it was questions that we compiled together. So we thought a one-on-one would kind of let us tap more directly into the students' individual needs. And so we also did that to get an in-depth understanding of what kind of support that they needed to pass that exam. We also partnered with our internship sites or our employers who are in the IT industry to find out what the requirements were, what they were looking for in that industry, and what we needed to prep our students for while entering into the workforce. So what we learned about our improvement strategy was that students, they were having issues with connecting the theory to the practice. They also, when we put together tutoring sessions, and the turnout wasn't that great. So even though we did get this information from the students saying, hey, this is what we want, the turnout wasn't so great. And I'm sure it was after them kind of discussing things with each other. And there was a lot of anxiety that they had, and their confidence level was a little shot too. So we knew that they needed a more hands-on approach from those surveys and from the one-on-ones. And they wanted to be able to kind of get into the industry and tie what they learned in the classroom to kind of a hands-on experience. So what we did from getting all that information, we decided that we were going to abandon our initial strategy, which was the tutoring strategy, because it actually did not meet the needs of our students. And we said, you know what we're going to do? We're going to test an internship strategy, which was probably one of the best things that we could have ever done. So in doing that, we ended up having really great outcomes. And from the picture, those are two of our graduates that actually successfully came out of the program. This is ongoing, of course, but these are two that were kind of the first two to come out of the gate once we implemented that internship piece. So we were really excited about that. And it also gave the students motivation who were still in the program, who are still in the program. So what our participation in Project Impact, the value that it added was that we were able to identify a lot of areas in our program that we didn't know existed. With Mathematica, with RCL, we were able to kind of delve deeply into what we were doing and say, okay, this is working and this isn't working. We learned that abandoning a strategy, it didn't mean that we weren't effective, because you do kind of look at yourself like, this is not working, maybe we just did something wrong. And through the RCL process, we learned that that definitely was not the case, which was also a great confidence booster for our organization as well. And for future rapid learnings for the program itself, we are going to use it. We have an adult ed program that we've already implemented into it. My director has met with that team, and so they're also starting to use RCL strategies. And so we're thinking that they're probably going to have just as great results as we did in the program as well. But two of the things that I think were super important that we learned was that you have to be patient with this process. Initially, we came in, we were like, what is going on? Like, it made no sense to us what was happening. And as we went along and we were patient and we got involved and engaged, we learned that it really is a great process. It helped us get to a level that otherwise we might not have been able to get to. And also we've learned that we can't get too attached to any systems because when you do, it makes it harder for you to move forward and to welcome those new strategies in too. So we learned that it's okay to abandon our strategies. It does not mean that we failed at all. So, so we're grateful for that piece of it. I'm sorry, guys, I had my timer on, so I didn't go over.
That was perfect, Angelique. Thank you so much.
Thank
So
you.
good to hear. So good to hear from you. Okay, our next group, and then shortly we'll have time for some questions too. So York Community Action.
Hi, everyone. I am Megan Arsberger. I'm the Director of Economic Opportunity at York County Community Action. We're located in Maine. For our overall grant proposal, we were heavily focused on access to our services and primarily what we call new Mainers. So immigrant, asylum seeking, and refugee population in our area, especially because that was a very large growing, and continues to be a very large growing population in our area. And so we adopted many strategies to try to increase access to this population. But one of the strategies was to actually look internally at whether or not we have the capacity to serve new Mainers with our own team. And so one of the things that we were able to test was simply doing a training of our language line to build capacity internally with our own team to make sure that they understand the existing resources that we even have available to them. In addition to the training, we developed a how-to guide that is really easy for people to access, and we have mini cards that people can keep right next to their phones and their desks for easy access to help them understand how best to utilize our language line so they don't forget or have questions later on. And so we did do pre and post training surveys of our employees, and we also piloted the initial training with a small subset group within our organization. We trained about 20 people at our pilot training, and we have a staff of about 250. So we kept it small. And we wanted to understand their satisfaction with the training, if they feel like they gained some knowledge. And also we assessed sort of the pre-use of the language line and post-use of the language line to see if it increased in usage after receiving the training. Overall, we found that oh, and I should also back up and say, in addition to that, we interviewed people, our employees, prior to the training and then after the training. We did the interviews in addition to the surveys, largely because we wanted to make sure that we were capturing other things that would be needed in addition to the language line, so that we could hear directly from our team regarding that. So overall, our employees reported an increased confidence in using our language line. They really found the how-to guide easy to use, really valuable. A lot of people didn't even realize that we had the resource available, and it's been an existing resource. So that was really good to make sure that people knew about it, how to access it easily, making them feel less afraid to use it, knowing that it's a really well-supported tool. And overall, we found that the team really said, overall, please do scale this up. Everyone should have the training across the whole agency for us to adopt the training. That being said, though, because of our surveys and interviews, we did find that people said that they wanted more cultural competency training in addition to the training that we had created. So it was sort of a please scale this up, but also include some additional training for us in the future. So we're currently working to build in those trainings as we move forward with our team. And so this really was allowed us to sort of pilot something new before rolling it out agency-wide, which was really good to get some feedback from everyone. It helped us learn the process for continual improvement. And it's really great because, as I referenced, we sort of have a larger plan around increasing access with this population. And so internal training is only one piece of it. And so the rapid cycle learning is something that we're going to be using as we continue to build out this strategy. So for example, we're building a client portal to have more access to people through that. And we're going to be doing lots of rapid cycle testing of features with that portal. We're also testing it with community partners as we move forward. And we want to be able to share this work more broadly with our community partners as we move forward with this, and our work with social determinants of health. So overall, we just would love people to know that, as I just shared, you can test something pretty small, even when it's a part of a much larger plan, because we do have a much larger plan around this work, but something as small as testing this one piece, this one training, is really ideal. And so just recommend people give it a shot, even with something that might seem pretty small and simplistic.
Thank you so much, Megan. Wonderful. I love that. Test something small. That's the whole idea. Okay, so our last presenter in this group of 4, Community Action, Pioneer Valley.
Hi, everybody. My name is Gilad Marone, use he and him pronouns, and I'm the coordinator for the Community Resilience Hub, which is the project that we received this grant for at Community Action. So we're building a community center with coordinated access to services and resources. And we use the rapid cycle learning process to update an onboarding document for staff and volunteers at that center. Through many conversations we had leading up to this, that was identified as a core need that would really help support growth for the center in the future, and specifically having an onboarding document that centered core values and safety protocols. We had a version of that and found there was a lot of opportunity for growth, and that could be a key support to enable that growth. So we did interviews with the staff to basically better understand the existing systems and the spaces where there were gaps or spaces for growth. We also then did a focus group with staff and volunteers to better understand some initial updates that were suggested and see how they fit into the system. And then we also collected both oral and written feedback from individual staff members who had started to implement some of the procedures in the onboarding document to basically refine it and better understand what was working. And then at the same time, our team did some research into other community centers that were similar to ours and brought in some insights from other onboarding documents that we found. And throughout this process, we really better understood that staff wanted to be a core part of reviewing that onboarding document and really helped center that process around core values and make the document as useful as possible. And in the process of discussing those things and doing trainings together, we were able to, along with those staff, hone in on how do we construct values that really reflect trauma-informed care and harm reduction approaches to running a community drop-in center, where you're engaging with folks who have a variety of mental and physical health crises. And how do we create those values so it creates safe space for those folks? So we reviewed this onboarding document, we developed new core values, we established kind of plans to do an iterative sort of approach around that, where we'll continually review that onboarding document at regular intervals throughout the year. And that's really built more capacity within the team to feel like they have autonomy and determination of how things are run, and leads to a greater sense of sort of ownership and commitment to some of this work for a lot of the core staff. They shared in focus groups how impactful this process was for them. And overall, in terms of the RCL process as a whole, it helped us as a team better understand the complexity of all the different partners that were coming together in this space, and how we needed to use core values as the sort of the common thread amongst them all, or the common denominator to bring folks together, and how effective that was, that we wouldn't have recognized if we hadn't gone through this focus groups and the individual interviews for the RCL process. We also developed some core strategies that we're continuing to apply. And overall, this helped both the staff and community actions team better understand what are the root causes behind some of the challenges we're addressing on a day-to-day basis, and how can we slightly shift how we do some of this work so it aligns with those values, while also being able to work at addressing those root causes. And as I mentioned, these are plans we're going to continue using. The rapid cycle approach overall was really helpful, especially the iterative nature and the way that it engaged a lot of staff and volunteers, so they all felt they had voice and representation in the process, and were able to see their requests and questions reflected then in multiple versions of this onboarding document that we created, which only created further buy-in from them all. So it went really well overall. We're still in a process of kind of refining that and kind of completing some final focus groups, but we've gotten a lot of really great positive feedback. And in terms of recommendations for others, we started with a much larger challenge, and then early on in the first month or two, through conversations, we were able to hone in what we were doing to a much smaller challenge. And so while we were excited about the big complex challenges, we realized that it would be much more effective for us to really start small. And we also really learned throughout the process that involving both staff and volunteers who are part of these programs from the very beginning has been really effective in a number of ways, not just building buy-in, but also gathering really local expertise, sort of on the ground knowledge that program directors oftentimes don't have as much kind of regular engagement with. So that was really helpful. And overall, I would just say the Rapid Cycle Learning grant program and support provided were very beneficial for the organization. And I would strongly encourage all those on the call who have the capacity to push for this program to be repeated and continued as a regular program, because I think it supports a lot of great community-based organizations around the country. Thank you.
Thank you so much, Glad. That was wonderful. I feel like you pulled together several of the threads that we heard in our first couple of presentations too. So we have a few minutes now for Q&A. Would love to invite folks who are thinking things over, mulling what you've just heard, to share a question if you have it in the chat, or feel free to unmute. Um, I do have one question. I wanted to hear from all four of you. Um, I noticed that several of you talked about, the role of staff in this process, right? Like how you engage staff, created buy-in. In some cases, you were, training staff to do something new as part of your test. I'm curious to hear what it was like to include a broader group of staff than usual in your kind of design and refinement process. Was that new for you? Was it uncomfortable at first? How did it go?
Um, if you don't mind, I'd like to say something.
Sure.
Oddly enough, I actually was hired through this process. So I guess I was the one I had like all the questions. So I was like the newbie coming in. So I was very fresh collecting information and meeting with various staff members to kind of learn what what roles they all play within the training program itself. So I think it was so pivotal for me because I'd come from a workforce background, but to be able to tie everything together and then also problem solve at the same time. I think it was so beneficial to know all these different players that were on board and how easily it was to get everyone to kind of come together to kind of solve what was going on with our training program.
Yeah. Thank you, Angelique. And I'm seeing a question from Rita in the chat. So how did you decide which process to assess first? So how did you decide what to focus on? And I'm thinking about both, I think community action, glad you mentioned this, and Angelique, you too, that your original tests, you realized that like the challenge you thought you had was different than what it actually was, right? Like in this process, you kind of uncovered more about the real sort of issue. Um,
Yeah.
does any of you want to speak to how you decided what to focus on for your rapid cycle test?
I can share. So at York County Community Action, we actually we're jumping more towards developing all of our outreach materials to new Mainers, working with our community partners, and kind of related to your question about engaging employees and staff. The funny thing is we actually did all these focus groups. We met with new Mainers, we created all these materials. And the funny thing is that as we were about to launch our campaign, we realized that we should talk to our employees about whether or not they feel prepared and ready to actually handle the influx of new Mainers who might start working with them. And so I'm just sharing that we had to pivot as well, like that you think, oh, we're going to be testing outreach materials and a marketing campaign and doing our client portal and all these great things. But then we had to step back and realize like we need to make sure we have everything we need in-house prepared to handle a new influx of new Mainers coming to our organization. And so then we almost backed up and had to have those conversations in-house. And that was really important for us. And so I guess the answer is that you kind of jump in and start asking more and more questions. And as you ask those questions, you start to kind of, pivot more and more to where you need to go. But you do need to kind of just jump in and continually ask.
Thank you, Megan. Very well said. So folks, I wish we had so much more time for this Q&A. I feel like we could talk to you all day, but we're going to move on to our next group of presenters. But thank you all so much for sharing with us about your organizations and the work that you've been doing. And I see there's a great question in the chat too. So if anyone who just presented would love to share some thoughts on the question that just popped up in the chat, please feel free.
Yeah, can I share one thing before we move on?
Oh, sure thing, sure thing.
Kind of in response to a few of the questions and what's in the chat now, something that was really valuable at Rapid Cycle Learning was the orientation towards broad participation from staff across the organization, not just program leaders or managers. And what we saw was really that helped break down power structures and helped amplify folks who are on the ground and have local knowledge and local expertise, and that oftentimes program managers did not. And we found that engagement with direct service staff brought more relevant knowledge and information to the processes we were doing. And so I think that was beneficial from the perspective of what Rapid Cycle did for us. And it also led us all to say, wow, it would be great if Rapid Cycle process even further kind of directly pushed grantees to be involving all staff in broad participation, even providing frameworks around breaking down power structures and what are typical power dynamics that exist and how we can navigate some of those.
Wonderful. Wonderful. Thank you for sharing that, Gilad. Very well said. Okay, group 2. So we're going to be talking now about tests, strategies related to referral processes and coordination. So first things first, we're going to hear from Total Action Against Total Action for Progress, TAP. Thank you.
Hi there, I'm Stacy Shepard with TAP. I'm the Director of Housing and Human Services. And one of the things that we really wanted to improve on was an entire agency enhanced intake process. We really wanted to look at how we better align for clients and improve the process of intake. So we created a digital process to make things faster for folks to onboard with us for services and streamline from program to program to program the way intakes are done. And this was everything from retraining staff from program to program, to revising agency policies, to creating a new handbook for clients that were coming in for services. It was really just a total change of practice for our agency. And so we did this by really looking at data monthly to see that people were actually using the new digital link to register for services, that people, when they were registering, that they were putting their family information in, because the goal was not just to serve the person that was registering, but to serve the whole family, to improve our whole family process. And that link was then creating internal referrals and external referrals, and that people were actually using that, and then how often they were using it. So along the way, we learned a few things. We learned that staff needed some retraining. We learned that we needed to make continual edits to our handbook as part of our RCL process. We actually made about 4 edits along the way. And that we also learned that this process allowed us to do a better job with follow-ups with our families, because it was an intentional, mapped out process. And then the evidence decisions that we made based on the data, using our internal Empower system and analyzing the data, is we were able to adapt this process along the way and change it and improve our screening tools and assessments. We changed policies and procedures where we had been stuck for a long time and many years, and including that handbook that I talked about with the edits. And then we were also learning that we needed to train staff, and not just train them once, but train them multiple times, and then have a monthly training where new staff coming in could be orientated, not just on this whole family process, but also on what external resources are out there, what TAP programs look like, and what's available to our families and our community. The value that we have now for our organization is we're better at being able to adapt and change. Through our old process, we've kind of gotten stuck and we're not able to really adapt and make change. And we've really been able to create tools and kind of move on. The other thing is we've been very transparent about what we've been doing, because some people have said to us through this process, why are you changing this again? Why are we doing this again? You just changed it. Why are we? And so we've really been able to explain that we're really trying to fix something, to change something for the better. And also looking at that data and how that works to improve the process. The future plans for what we're doing is to use it in some of our other programs and processes, because it's worked. It's helped us kind of get out of a rut and be unstuck. The trainings and the network process that we're doing down is helping us break down silos. And we're having monthly meetings, and some of our teams, like our workforce team, is getting together monthly. Our case management teams are getting together monthly. So some really good things are happening out of this process. Recommendations that I have is to trust the process. It felt like a lot going into this with monthly meetings and TA and all of the other things, but it really has been a great learning process and it's been effective. And then also that transparency piece and that communication of letting people know this is why we're doing it, and we're doing it because one, it needs to be fixed, and two, we're really trying to do something better. And then accepting the feedback from a team approach, because we had lots of buy-in and we had lots of voices, and the willingness to be able to accept that feedback from our team. So thanks.
Thank you so much, Stacy. Okay, let's hear from our next team, Safe Alliance.
Hello, everyone. My name is Tim Williams, and I'm the Director of Shelter Services for Safe Alliance. Presenting with me today is Corey Goldstein. Safe Alliance is a local domestic violence and sexual assault resource for Mecklenburg County here in North Carolina. And as you can imagine, running a shelter for those impacted by trauma can have its challenges. But what we have learned through the rapid cycle learning process has been very beneficial. Our rapid cycle learning process focused on creating a trauma-informed intake process. Intake into our shelter involves staff across multiple programs, as our hotline is the initial referral into our shelter. Once a victim is referred to our shelter, they have the additional screening to ensure that our shelter is the safest location for them, as we are sheltering those in imminent danger. Our goal has been to create a system that requires the survivor to only tell their story once, but this involves cross-program collaboration and efficient documentation in order to be successful.
Corey, I think you're muted.
Okay, I got it.
Thank you.
Hi, I am Corey Goldstein, and I have worked in partnership with Tim on this project. As Tim noted, we tested a new intake process for our domestic violence shelter. Through the rapid cycle learning process, we collected and analyzed data from a multitude of sources, including a staff survey, supervisor observations, and a staff focus group. In running a 24/7 facility, we wanted to ensure that we afforded opportunities for each staff member's voice to be heard. As a result of the data collection, we learned valuable information about our new intake system. We learned that overall, the new intake process was a success as clients' needs were getting met and there were benefits to staff and supervisors. In navigating secondary trauma, we always ensure that we are supporting victims while also providing the needed support for staff. We also learned the training materials, more specifically our flowchart we created, was effective in ensuring consistent response. With staff operating across multiple shifts, this information is valuable to the success of a 24/7 program. Based on the data gathered, we made the decision to adapt the new intake system as a permanent process. Although the data showed initial benefits, we also made the decision to seek out additional information that could improve the process even further. Our next steps will be to engage in additional data collection at a later date that will allow for some clarifying questions and increase the pool of staff surveyed. Overall, we are grateful for this opportunity and have gained benefits that will be of value for years to come, especially the knowledge around the use of rapid cycle learning. Our plan is to continue to incorporate rapid cycle learning into other projects at the agency. In the beginning of the project, the thoughts of navigating this process was somewhat overwhelming, but with the amazing support we've received, we feel much more confident. As others consider using rapid cycle learning within their organizations, we want to highlight a few things. First, that preparation is important, and if done correctly, will be a great guide throughout the process. Also, it is great to think big, but you must start small. By focusing on a small area, you are more likely to gain results and ensure you are on the right path towards the larger goal. So in closing, it's been a pleasure to work on this project, and we are appreciative of the time, support, and funding that has ensured our success. Thank you.
Thank you so much, Tim and Corey. It was wonderful to hear from you. Okay, Norwest Cap, our next group.
Thanks, Rachel. Good afternoon, everyone. My name is Emmett Slobosian. I'm the program coordinator leading Norwest Cap's RCIP project management team. Norwest Cap is a community action program serving the 5 Northwest counties in New Jersey, and we have a reach of approximately 30,000 participants each year. In summary, our project was designed to address really 2 main challenges that we experience in our intake process. Number 1, the number of steps required to assign a case through internal referrals was too many, and the visibility of the assignment was difficult to track. Number 2, one of Norwest Cap's guiding principles is that we will always respond to inquiries within 2 business days. The problem is that we have not really had any way to evaluate that guarantee until now. So for our test, we developed a new system for making internal referrals, which allowed us to pivot away from our current CRM software to our company's use of Microsoft products such as Teams and Planner. So what this test looked like was internally, we built a referral form using Microsoft Teams to notify our staff via email and a Teams message that they've been assigned a new case and give them a deadline to reach out by. This addressed the lack of visibility and established a time frame to meet that 2-day guarantee. Externally, we modified our inquiry form to ensure that we collected email addresses and phone numbers from participants, but we also reduced the number of required fields with the intent to save participants time. Additionally, we automated an email to send out once that internal task was created to inform the participant that the inquiry had been received and assigned and who would be reaching out to them, with the hopes that this would reduce uncertainty on the participant side and the hesitation to avoid unknown phone numbers. Our automation linked the forms in Microsoft Teams to tasks in Microsoft Planner so that we could do 3 things with that. 1, use this as a center point for automating emails to staff and participants. 2, track the number of referrals that each staff was assigned. And 3, check timestamps to confirm the duration of the task from assigned to completed. So we collected this administrative data and analyzed it in a dashboard to understand our callback performance, which could be analyzed at the staff level or the overall group performance. We also conducted listening sessions with our staff to gather qualitative feedback to help improve the test over time. For our results, we didn't really have a baseline data on our callback performance prior to this project, so we were able to establish a benchmark over our first couple of weeks in the test period. So we began our test in the middle of February and saw 160 referrals made throughout March 1st. Of those 160, we saw 28, that's about 16%, were contacted outside of that 2 days window. We could partially attribute this to learning a new process, but nonetheless, that became our benchmark to improve upon. In our staff listening sessions, we uncovered a general agreement that the test improved the visibility of the assignments and the expectations of callback deadlines. However, we also heard that the number of notifications was too high, so we tweaked our process to test only sending Teams messages instead of emails as well. And over time, we saw the percent of late calls decrease to virtually none. By the month of May, we had multiple consecutive weeks with 0 late calls and a monthly total of 4.5% calls being late. So that's about a 4 times improvement from the beginning of the test. This data allowed us to ultimately determine that this new process was a success and we could fully adopt into our standard operating procedures. Our thoughts about the project impact and RCIP is that we really appreciate the opportunity to be part of this program, and we've already rolled out the philosophy of plan, study, act into our project management actions. We'll continue to evaluate other programs and processes with the lessons of rapid cycle learnings in mind. The biggest takeaway we've learned is that in some situations, making small incremental changes over a short period of time can actually produce a bigger impact than trying to tackle a single large problem over a long period of time. Thank you for your time.
Thank you so much, Emmett. Okay, so now we're going to hear from Ashtabula, our last presenter in this group of 4, and then we'll have some time for Q&A.
Good afternoon. I'm Carmen Kula with Ashtabula County Community Action Agency, a private nonprofit social service organization in Ashtabula County located in Northeast Ohio. We're 1 hour east of Cleveland. Our project was to create a community-level system change in the way that healthcare is provided. We're working to create a Pathways Community Hub, a centralized model of care coordination that revolves around the person, specifically Medicaid participants, to address modifiable risk factors and improve health outcomes. A major component of a Pathways Community Hub is connecting the participant with resources to address 21 specific modifiable risk factors or pathways. The improvement strategy we tested was the case manager's use of a resource information tool, essentially an Excel spreadsheet, to connect participants with the resources available to address an identified need or pathway, as well as their supervisor's observations during the RCL test. At the same time, we tested the effectiveness of our training on the use of the resource information tool to ensure that all 5 case managers understood how to appropriately use and document the results of the RCL test. To evaluate if the training was effective, immediately following the training, we conducted a survey to determine the case managers' and supervisors' understanding of the RCL test instructions. No issues were indicated at that time. After the RCL test, we held a virtual focus group with the case managers to collect data about the user-friendliness and usefulness of the resource information tool. We did a separate focus group with their supervisors to determine any productivity or other issues that were encountered while they were utilizing the resource information tool. During our analysis, we learned 5 key things about our strategy. First, the initial resource listings were kind of inserted randomly. The case managers told us it was hard to find all the resources that pertain to a particular pathway and that the resource listings could be better organized for ease of use. Second, the resource information tool was initially only provided in hard copy, and they requested an electronic version as well. Third, the resource information tool had multiple columns of information regarding each resource. For example, name, address, city, zip, phone number, age eligibility, income eligibility, and so on. The case managers told us that the tool was too long, making it difficult to access information across the columns of the sheet. Fourth, the case managers did agree the items in the resource tool were useful. And lastly, despite these issues, the supervisors did not report any overall loss in productivity during the RCL test when the case managers used the tool. We decided to adapt the strategy. We shortened the length of the resource information tool to make it easier to use by reorganizing the resources alphabetically and by type of resource or pathway and combining the columns together. For example, putting name, address, city, zip all in one block, combining eligibility criteria into all one block. Since connecting participants to resources to resolve the identified needs or pathways is a major component of the care coordination system, as well as a requirement to become a Pathways Community Hub, participating in Project Impact helped us to develop and ensure that our resource information tool was the most user-friendly and useful tool for case managers, and it allowed us to meet our certification requirement. Prior to Project Impact, we tried to anticipate every little detail before implementing policies or procedures. This delays our start, and when we ultimately launch, we would still encounter things that we couldn't have anticipated. Through Project Impact, we learned how to plan, then quickly assess for viability and improvement, make those changes, re-implement, and assess again. Also, learning in the analysis process that abandoning the effort might be the best outcome was very valuable. Generally, once we had put in all the rigorous final planning, we were reluctant to determine it wasn't the right strategy. When we implement new projects or procedures in the planning department, we'll utilize the rapid cycle learning to increase the success of our outcomes, and we'll introduce the rapid cycle learning with partners when we're collaborating on projects. I would say to others interested in using rapid cycle learning, clearly identify the known challenge or the gap in knowledge, determine what you want to learn, and design improvement strategies to assess the outcomes. Thank you.
Thank you so much, Carmen. And thank you to Emmett and Tim and Corey and Stacy as well. It was wonderful to hear about all of your projects. So we have time for just one question, I think. So if anyone has a question, would love to share it in the chat, feel free. Otherwise, we have one kind of thing we're curious about. So many of you spoke to the value of small incremental changes, right? Choosing something really small, time limited to focus on. And we'd love to hear a little bit more about that if you're willing to share. Was that unusual for you? Did it feel uncomfortable at first? Anything you'd like to share about that value of starting small?
I can speak to that a little bit. I think with Safe
Okay.
Alliance, it definitely in the beginning, I like to think broad and big, and that tends to be where my role stays focused. So it was somewhat of a challenge to narrow down that focus of really looking at small steps to move forward. However, I see the benefit, and it was really valuable to recognize that we need to look at these small steps so that we are doing those pieces along the way correctly. And ultimately, we'll get to the bigger goal and we'll do it really effectively and create something that's even better than if we had kind of gone really broad from the start.
Well put. Well put. Thank you, Corey.
And I'll speak to that as well, because we really started with something small, which was just an intake tool. But that really opened up a can of worms. And that small thing that we started with bridged us into so many more things that we realized we needed to fix. So
Yes, yes, yes. And I see Annie reflecting that in the chat too. The continuous nature of this work. It's a wonderful point. All right, folks. So just to kind of keep us on time and make sure that we've got enough time for all of our grant recipients to share their work, we're going to move on to our next group of 4. So we're going to start, I believe, with United Community Corporation. So this group is talking again about project delivery.
Hello, good afternoon. United Community Corporation is a community agency located in Newark, New Jersey. My name is Andrea Melanson, and I'm the Associate Executive Director for UCC. Our program for our rapid cycle, we wanted to test out a new innovative way of delivering warm meals to low-income communities, and by using a food truck, and we call our food truck UCC Cafe. The strategies that we tested was the mobile food truck delivering meals to community sites, and also we tested out our mobile cooking and nutrition classes that was part of this initiative. The data that we collect and analyze, we wanted to do it in different surveys, in which we were able to collect information about the quality of the food and also the delivery services. For our cooking and nutrition classes, we wanted a feedback about the nutrition and the cooking classes and how efficient was being. Many things we learned, and we were able to learn ways to improve our program. And there are many ways that we could improve the program in several ways. And for the mobile cooking and nutrition classes, instead of doing large pop-up events, we were able to get more information when it was smaller sit-down classes rather than larger, and more of an interview way rather than just a survey. The decisions that we were able to make, we were able to adapt this strategy, and we were able to revamp the whole project. We purchased a new equipment for the food. We were able to fix some of our food presentations, and also create a better quality of meals, as well as we had to hire new staff to be able to make these changes. And based on these changes, even though you think, wow, you have to revamp a whole program, we were able to scale up, so that rather than just delivering meals to our sites, which are homeless shelters and senior programs, we were able to scale it up to some of our partners and throughout the community of Newark, and even farther than Newark. So we went from like 500 meals a month to 2,000 meals a month. We were able to, the impact of this program was huge. We were able to launch this entire new program, and we are continuing to obtaining participant feedback to know the quality, so we are always improving. This was a perfect project to use rapid cycle learning because it's a tangible program. You can see meals, are they being good or they may not, they're being delivered warm, and things like that that you can make quick changes. What we would recommend it is that be ready to abandon an approach, be ready to not just gather this data, but also be ready to make the changes based on this data. And encourage the staff to participate. So if you need to make extreme changes in the schedules or even changes stuff, that people know what is happening, that the staff members know what is our process and why we are doing this. Thank you.
Thank you, Andrea. Action for Boston, BCD.
Hi, everybody. I'm very pleased to be here and, of course, hear about the other important urgent work, necessary work that all the other grant recipients are doing. But for the sake of time, I'll hop right into it. I'm representing Action for Boston Community Development. My name is Nick Owen, and I'm the program director for our food insecurity initiatives. So we run a food delivery program, which is in partnership with Stop and Shop. Through this program, we provide free monthly deliveries of primarily food, as well as some necessary household non-food items. So as part of the rapid cycle learning cycle, we tested personalization of monthly deliveries of our grocery baskets and non-food household items through Stop and Shop with the goal to improve accessibility as well as the client and staff experience overall. So when it came to collecting these data, we focused on surveying clients regarding the amount of food that they were actually eating when they got the deliveries. How did the delivery times work or not work for them? Were their dietary needs met? What dietary restrictions or allergies did they actually have? How was our communication working or not working? How was communication between Stop and Shop and the recipient working or not working? We also assessed the need for these non-food items as well. In addition, we did conduct a staff interview with the intention of firstly just getting a real recorded sense of the experience working on the program. Then more specifically, we looked at the balance of the workload. How could we balance a workload while also wanting to and spending the time to customize each individual basket for the recipients? We learned a lot. Specifically, we learned that personalizing orders and offering this customization is certainly preferred by clients, and it's relatively easy for our staff members to do. We also learned that notifying or the notification of a delivery actually arriving to a recipient's home, that notification by coming from Stop and Shop could certainly improve in terms of the frequency and clarity of that notification to ensure a successful delivery. We also learned that text message communication is certainly preferred as a more accessible means of communication for many of those folks who are enrolled in our program. Now, when it came to an evidence-informed decision, we adapted a strategy to accommodate dietary restrictions by looking at the most predominant dietary restrictions that we found in our survey, as well as providing household supplies each month as we saw the need was there and it was high. And we also have permanently implemented the modification of baskets on a monthly basis to clients. We are also implementing a texting service to increase the accessibility and effectiveness of our communications. And moving on to the later piece of this poster is really talking about the added value of project impact. So these findings really helped us to just gain a better understanding of the experience of our recipients and our staff, which sounds basic, but as we know is very important. And this has allowed us to more appropriately and effectively serve our community. In the future, we are looking at making deliveries more accessible through having various package menu options, as well as conducting a second round of survey. And if I could give a piece of advice to any other agency or organization with regard to rapid cycle learning, it would be plan ahead to allocate appropriate staff time, effort, and resources to this effective, necessary approach. Thank you.
Thanks so much, Nick. It's wonderful. Okay, so next I think we're going to hear from Jessica with Albany Community Action Partnership. Jessica, I don't know if it's just me, but I can't hear you. Jessica, maybe you can troubleshoot with Derek and we can move ahead to Worcester and then come back to you. Is that okay? Yeah, sorry about that, Jessica. If you're able to connect with Derek and troubleshoot, then we'll hear from Worcester first and then we'll come back to Albany.
All right, good afternoon, everyone. I'm Charla Hickson with Worcester Community Action Council, and I'm joined by my colleague, Melissa Trinidad. We're a community action and anti-poverty agency located in right in the middle of Massachusetts. So we've been building our financial empowerment programming for several years within a new department we call our Resiliency Center. And the newest component of this work is addressing benefits cliffs so that we can keep families whole and also help support them in their journey to economic mobility and with economic mobility opportunities. We brought on, to do this work, we brought in a coaching model, and with that, a financial coach and 2 benefits cliff coaches. So these are new positions to the work. And we knew that these coaches would have some similar overlapping roles and would be working with shared clients, that clients might need to meet with both coaches at some point in their journey. So we wanted to find out how we could facilitate strong communication between the financial coach and the benefits cliff coaches. So to do that, we tested our regular weekly team meetings and the agendas for that and how we communicate within those meetings and use those meetings. We tested some new client tracking and project management software, and we tested in a client inquiry form. And we collected data directly from our coaches in our weekly team meetings as a focus group and with individual interviews with our coaches. And I'm going to turn it over to Melissa to talk a little bit more about what we learned.
So Worcester Community Action Council learned from the improvement strategies that the weekly team meetings that we were holding were worthwhile. Team meetings with structured agendas, they allowed us to stay on track, also allowing for full participation from financial coaches to management to the Cliff Effect coaches. Coaches noted that we all felt supported having this carved out time weekly to discuss the clients and the program updates. As Charlotte mentioned, some of our clients were meeting with both the Cliff Effect coach and also the financial coach. So we had determined that there was a need for an efficient communication tool using a client tracking database. We also had learned that there was a need for a tool to decide which coach would receive and respond to initial referrals.
Some of the evidence informed decisions that Worcester Community Action made based from this information was to abandon our multiple referral processes and adapt to one referral process, which was our inquiry form. This inquiry form is linked to our new client tracking database, mondays.com. This database inquiry form also supports that the appropriate coach is assigned to the incoming client, speeding up response time, and also increasing efficient communication amongst us coaches. We also had determined that it was our decision to maintain the weekly team meetings. We agreed at times we could shorten or we could extend our meeting times. And also, as we triage the need, we could hold individual meetings as determined. So, Charlotte?
Okay, and then as far as the value that this project and rapid cycle learning brought to our agency, I think we all agreed that it was certainly valuable, and that mainly building in this time for reflection was very worthwhile, something we could build across the organization, across departments, but also to build within individual programs. For the future, we do plan to conduct a second rapid cycle test of our client tracking software once we have finished building it. And then we're also planning to share with our statewide community action network what we've learned about rapid cycle learning, but also our learnings about coaching for benefits cliffs. And we would certainly recommend to others to carefully craft and protect the time for rapid cycle learning. I think we were pretty good and practiced at putting a plan together and timelines, but protecting that because of everything else going on and implementing that we found to be much more challenging. And we'd also recommend defining what rapid cycle learning can mean for your program. That was something we learned, starting small and not going too fast so that you don't miss time for that reflection. And thank you very much.
Wonderful points. Thank you, Charlotte and Melissa. Okay, let's go back to Jessica.
Rachel, my apologies for that.
All good. We can hear you loud and clear. Sound
Awesome,
wonderful.
awesome.
Thank you, Jessica.
Good afternoon. My name is Jessica De Jesus. I am the director for Albany Community Action Partnership, Community and Career Services Department. So with our Rapid Cycle Learning project, we implemented our VIP training track, which is our Valued in Your Profession. With over 10 years of recruitment and enrollment in entry-level healthcare training programs, we knew that individuals that participated in our program wanted to go back to school, increase their knowledge base, and increase their income, but they did not have the opportunity to do so because it would mean that they would have to decrease their work hours. So we developed a VIP training track, and we also implemented a 3-step staff input model in which we made sure that not only our staff were part of the buy-in process, but management team were providing clear communication as well. The data that we collected was really impactful for the entire program and the entire process because we looked at our pre and post surveys of our participants that were enrolled in the VIP program. We learned that in the first half of the in the first half of the grant cycle, only 30% of our participants scored us as extremely satisfied in the programs that we were offering in terms of our training, while in the second half of the program, we completely flipped that around and we had an 80% extremely satisfied rate with our post surveys. We monitored our household income, pre and post of our intake and eligibility process up to employment. And we monitored that feedback pre and post implementation of the 3-step staff input model. Within the VIP model, we quickly learned that at point of employment, our participants increased at an average of $2 to $3 an hour. We learned that in changing our model from 60 hours of our workforce development credential program into truly honoring the value in your profession and creating a remote option for our participants in which they got to self-select asset development workshops, our increase in success rates, our passing rate was 98% with the change in from 60 hours to our remote model. Our staff and participant relationships, they strengthen. And we knew that because of our completion rates dramatically increasing as well. Our success rates were highly impacted by our training model, in which students prior to VIP had to participate in set up from 7 to 9 weeks of in-person training, where we were able to move into in-training with our training partners, especially for healthcare, into a weekend model or evening model. We were able to learn that if with the continued 3-step input model with the VIP track, under the weather, with the implementation of the VIP track, our staff were able to feel as if they were fully invested. So it was important for me to pass the baton. As the director of the department, I had to ensure that I was consistently speaking about Rapid Cycle. It is unheard of for us to be able to have the ability to consistently and quickly change our processes within a grant, and staff had to feel comfortable and confident that they were able to come to the table consistently, share feedback on a daily basis as opposed to a monthly staff meeting. We also revisited our staff training materials, which was important because we also learned that staff, depending on how long they've been with us, had different messages for the participants. So we created our staff training binders, which are still ongoing. Currently, our 3-point model with our team is the leading factor in increased communication and decreased dropout participation within our program. RCR allowed us to redesign and refine implementation until we got it right. We continue to test the VIP model with employers, so we are moving more from customer base to our employer base, and now helping the employers identify key staff that they would like to increase education with. We also are sustaining RCL with our organization moving forward within our department. Please be comfortable with experimenting, failing fast, and trying again, and revisit the project implementation consistently.
Wonderful. Thank you so much, Jessica. It's so exciting to hear how this affected morale in your organization too, that kind of ability to ask questions, make suggestions, and see action quickly. So would love to invite folks who have any questions for Jessica, for Charla and Melissa, for Nick, for Andrea to share them in the chat. I have one question I'll kick it off with. So I heard many of you speak to the value of protecting time for reflection, for learning. How sometimes we get so busy, it feels like a luxury to kind of do this data collection work and to do this reflection, but that it's really valuable in the long run. So I'd love to invite any of you to speak on that if you'd like to.
I would definitely love to chime in because that was big for me. As you know, Rachel, as my coach, I was consistently saying that reflection was difficult because I was always knee deep in the trenches. What I found was that it was important for staff. And the reflection was not solely for me as a director or my management team. Reflection was critical for the staff. Once the staff were consistently able to come to the table, reflect on quick changes, be okay with that, that's when I started seeing our participation rates increase. Successful and our participation, our customers' success rate increased as well. Our surveys quickly changed once we were at the table on a daily basis as opposed to a monthly.
Yes, yes. Well said, Jessica. Charla, Melissa, Nick, Andrea, do you guys have any thoughts on that kind of value of protecting time or reflecting as a team?
I could maybe add that I think it means having the whole team buy in on that, but that it can also be helpful to have a point person as a reminder to say, okay, this is what we said we're going to do. Let's do it. But we did find ourselves kind of, it was an iterative process. We would revamp our schedule a few times in a row and did find that realistically we had to be somewhat flexible. So finding some kind of balance.
Very good point. Any other thoughts or chime in before we move along to our next group? Nick, I see you're.
Yes,
you have
I
a
think
thought.
what I might add, certainly seconding what everybody else has so eloquently stated. One thing I've just been tried to be as mindful as possible, especially during this process, is really taking the input and perspective from my team members who work, I consider, quote unquote, on the front lines, but directly with the recipients of the program, and just hearing their experience, because it's quite different from mine in the more management role, and that's very valuable. However, crunched for time, we might all be on our respective programs.
Well said. Thank you, Nick. Beautiful. All right, so let's move along to our last group of presenters. So we'll be hearing now from grant recipients who focused on recruitment and community outreach in their strategies. So first things first, let's hear from Gateway Wellness Center.
Good afternoon. Good afternoon. Hello, my name is Simone Henry. I am the project coordinator for Gateway Wellness Center's Project Impact Initiative. So just a little background on our program. At the height of the COVID-19 pandemic, Gateway Wellness Center saw a significant spike in referrals for youth and families to receive counseling and support services. Due to the mandated shelter place, we experienced an increase of school-age students who developed anxiety, depression, suicidal ideation, and various traumas due to isolation. We saw lingering effects of mental and behavioral health issues upon youth's return to in-person learning and their difficulties adapting to sudden academic changes. So knowing the barriers parents were having with accessibility, knowing the barriers that they were having with accessibility to counseling services, we aim to meet youth where they were. And with assistance from Project Impact, we were able to implement school-based wellness hubs in 7 schools within our community, and providing counseling students to kindergarten, from kindergarten all the way to 12th grade. And we have provided counseling to about 140 youth and families throughout the duration of the grant period. This initiative has allowed us to build a strong relationship with partnerships with school administration. We were able to identify a barrier in our community with school and community programming alike, which is parental involvement. And as you will see on our PowerPoint, that is what we really focused on, was parental involvement. Using RCL, we explored useful strategies to engage in parents, recognizing that we also have to meet parents where they are. We hosted community events, attended back to school night and other school-based activities, and built a rapport with parents who were seeking services for their child in efforts to collect data from parent surveys, knowing we did not have much success with paper and pen surveys in the past. We intentionally sent to engage parents in conversation while they completed a brief electronic survey. And RCL was very helpful in helping us create and establish that and implement it. In observing parents during various community events and analyzing the collected data, we learned that school-based counseling services are effective. We were able to reduce stigma regarding mental and behavioral health services. And over the course of programming, we've seen an increase in parental engagement, which was one of our major goals. And RCL has allowed us to see and value the importance of effective communication with the community at large. And we have made the shift from using the term mental health to normalizing the term wellness to promote a more positive outcome when working with families. Our participation in Project Impact has allowed us to learn how to utilize and monitor an effective surveying system that will help us to improve upon our programs, and it has allowed us to take a deeper look in our practices as an agency to better assess and address community needs. Through the increase of community engagement at events where we have been able to build a rapport with residents and bring awareness to mental health issues. Gateway Wellness Center has become the go-to agency, and we're very thankful for RCL for helping with that within our community for mental health services. We will continue to use rapid cycle learning as an evaluation and measuring tool for our school-based, community, and outpatient programs. And Gateway Wellness Center to influence decision-making as we improve upon and implement additional services. The opportunity to participate in Project Impact has been an eye-opening, rewarding experience. And for those who are interested in using RCL, the Gateway Wellness Center team would encourage you to be flexible, open to feedback, and comfortable with programming not going as expected when agency, community, and stakeholders come together for a common goal. It allows for lasting change. And we are proud to announce our programming has grown from a vision to better service youth in one school district to now servicing 3 school districts, and Project Impact helped to make that possible for us.
Thank you so much, Simone. That's wonderful. Okay, so next I think we're going to hear from Hampton Roads.
Good afternoon. My name is Carl Shirley. I'm the Director of Planning and Evaluation with the Hampton Roads Community Action Program. HRCAP is a community action agency that has been serving the residents of Southeastern Virginia for over 56 years. Our programs help residents to access educational, employment, housing, and other vital resources that assist them in overcoming poverty. The focus of our Rapid Cycle Learning project was the Whole Family Approach program, which we have been piloting for the last 3 years. The Whole Family Approach, as many of you know, also known as two-generational, multi-generational model, uses a holistic method of providing services involving the entire family in the process and providing an array of wraparound services that can assist families in becoming more self-sufficient. One of the challenges facing the Whole Family program is ensuring that staff in other agency programs, particularly Head Start, have enough information and understanding of the program to make optimum referrals. So the improvement strategy we tested involved reaching out to Head Start Family Services team and program managers in order to increase referrals from Head Start to the Whole Family program. The main strategy we used was providing presentations to Head Start staff during training that would provide them with critical information they needed to connect their clients to the Whole Family program. Some of the data that we collected and analyzed included current client satisfaction survey data, and specifically focusing on how clients were learned about or referred to HRCAP programs. We found that most commonly they were referred by family and friends, and also via schools and other agencies. So we also distributed, collected, and analyzed pre and post presentation surveys that were provided to Head Start staff to gauge their knowledge of the program. So what we learned from the improvement strategy was that the presentation did increase Head Start staff knowledge of the program, and that the program was able to receive additional referrals from Head Start staff. As a result, this strategy will be expanded by including additional training opportunities for staff outside of Head Start and possibly even working with community partners. Our evidence-informed decision resulting from this strategy is to expand the strategy with the goals of improving the intake assessment and program eligibility requirements that will allow us to increase the number of families enrolled in the program. We're also going to create quarterly lunch and learn events for Head Start staff to provide them with information about the successes of referred families, to reinforce their use of the referral process by showing them how these families are improving their lives. The Project Impact has definitely added value to our organization. It's empowered our organization leadership to become more involved in the referral process, which has resulted in improved procedures across the agency. Participation has also allowed us to refine our procedures for using data to make informed decisions. And we expect that will help us in improving service delivery and outcomes in the future. And based on the information provided during the improved referral procedures, we already have identified a need to create employment cohorts to meet the needs of Head Start families that need increased household income for families. Our future plans for rapid cycle learning include using it to continue to improve program enrollment, attendance at events, job readiness and placement services, and to create linkages with community partners and employers. Our recommendations to others interested in using rapid cycle learning is to engage staff at all levels so that they will be involved in the processes that are resulting from the program. And agencies should not be afraid to engage all of their stakeholders in the process, be it client, staff, board members, business owners, and other community partners. And I think that's all I have.
Thank you so much, Carl. That's wonderful. It's really exciting to hear about your program. Okay, let's hear from Latoria and Stephanie from Wayne Metro.
Thank you, Rachel. Good morning, or I'm sorry, good afternoon now. Good afternoon. My name is Stephanie Marchese, Assistant Director of Projects in the Innovation Lab at Wayne Metropolitan Community Action Agency. Wayne Metro is a community action agency serving Southeast Michigan. We provide assistance to low and moderate income families to help address their most critical needs. Our agency has over 75 programs, including educational, housing, and emergency services. We have shifted from a one-person, one-service approach to serving whole families through integrated services, two-gen approaches, and collective impact strategies. We are proud to announce that our agency was selected as Crane's 2022 Best Managed Nonprofit. This year's theme was recruiting and retaining talent. One way this was made possible was through our Project Impact grant. We utilized this grant to create the Growing Green Job Training Program, an innovative job training program that engages communities of color in the high-demand green sector job, specifically in the area of weatherization, where we see a huge worker shortage. The Growing Green job training consisted of 10 weeks of on-the-job training at 24 hours per week in one of our 4 pathways, which included weatherization installation technician, weatherization home assessor, water conservation auditor, and housing quality inspector. Participants were paid weekly stipends of $15 per hour, received certifications in OSHA 10, led RRP and health and safety, and wraparound coaching and supportive services were also provided to participants. We are happy to share that we have graduated 18 participants from the program. 2 participants were hired directly by Wayne Metro as permanent employees, and 1 has already received a promotion. 2 other participants are now AmeriCorps members serving at our agency. 5 participants are working for external companies, and the additional participants continue to meet regularly with their job coach for employment assistance. We look forward to continuing our rapid cycle learning for new and existing programs. I'll now turn it over to Growing Green Project Manager Latoria Glenn Carr to provide an overview of an improvement strategy that we have tested. Thank you.
Greetings, everyone. Thank you so much, Stephanie. My name is Latoria Glenn Carr, and I am the Growing Green Project Manager here at Wayne Metro. Our agency has learned so much over the past year utilizing the rapid cycle learning for our Growing Green on-the-job training program. I've worked for Wayne Metro for the past 6 years in various rewarding positions, but my current role as the Growing Green Project Manager / employment coach has been the most fulfilling. I really enjoyed supporting participants in advancing their employment skills in the weatherization field, as well as gaining a great foundation of what rapid cycle is all about. One improved strategy we highlighted was we tested program awareness and enrollment. We conducted various information and recruitment sessions at our weatherization training house. We collected data from pre and post surveys regarding recruitment sessions and was able to conduct several observations during these sessions of the client's demeanor and action during the session. 3 key points were learned. The first, we learned that candidates were attracted to Growing Green jobs because of the environment and community. Also, that our job title should include the words weatherization or energy. And finally, that candidates had more awareness about the weatherization field than we expected. We use these learnings to adapt our strategy to include more weatherization terms as stated previously in our job description. We observed during in-person meetings with candidates and reviewing various applications that most candidates were applying for our one pathway, home assessor, because they thought it was related more to real estate and mortgaging. Therefore, we named the home assessor position to weatherization home assessor, which helped candidates to understand that position or track more thoroughly. The project added value to our agency by providing quality candidates both for internal positions with our agency and connecting our internal partners as well. It also taught us to utilize the rapid cycle learning outcomes to better enhance our program. Our future plans are to continue to utilize the rapid cycle learning with new and existing programs throughout the agency for our internal staff as well as our external partners. The benefits of learning what RCL strategies are. And finally, for others interested in using rapid cycle learning, we recommend that you start with a small project, as folks have mentioned earlier, and utilize the various learning tests throughout the program implementation. We are looking forward to 2023 and to build on our future cohorts. Thank you so very much for your time and your listening ear.
Thank you both so much. That's so exciting to hear about how your program has grown. Wonderful, wonderful. So, okay, let's hear from our last grant recipient presenter, South Carolina Association of Community Action Partnerships. Forgive me.
Good afternoon, everyone. Thank you for listening. My name is Frederick Wilson. I am the project manager for the COVID Voices project at the South Carolina Association of Community Action Partnerships. SkyCap, as we are affectionately referred to as, is a statewide nonprofit community-based organization that aims to develop and support programs to promote self-sufficiency and improve the quality of life for income-eligible children, youth, individuals, and families. SkyCap serves as a state clearinghouse or hub for the community action, Head Start, and weatherization networks in South Carolina that provides various programs and services to meet the needs of our targeted population, such as comprehensive early care, housing, energy assistance, and efficiency programs, crises and case management, employment, income management, nutrition, youth, and senior programs, and a plethora of other programs. We launched the COVID Voices project. COVID Voices is an acronym for Vehicles of Innovative Change and Equitable Solutions. We are using innovative solutions and strategies to enhance, expand, and strengthen our statewide grassroots community-based partnerships to prevent, prepare, and respond to COVID-19, influenza, and other health disparities. SkyCap's improvement strategy includes staff training and tools to be community ambassadors for COVID-19 vaccinations. The data that we collected during the rapid cycle learning include staff focus groups about the usefulness of the training and associated tools and community ambassador activities after training. Also, administrative data on vaccine clinics held and vaccinations statewide. We learned much about the improvement strategies employed, such as staff reported increase confidence in meeting more of their community ambassador responsibilities, and staff suggested making the training more engaging and interactive. We made evidence-informed decisions by adapting the training and associated tools to make them more engaging and interactive, and retest, yielding positive feedback. By participating in the Project Impact Rapid Cycle Learning, we added value to our organization, which enabled us to pilot a new approach to serving our clients and learn how to use the RCL process for continuous improvement. We're looking forward to continuing rapid cycle learning at SkyCap by infusing RCL in other projects and build capacity to regularly collect, analyze, and use data to make evidence-informed decisions and share the importance of RCL with our community action, weatherization, and Head Start networks in the state of South Carolina. I would recommend to others interested in using rapid cycle learning to be coachable and flexible in building your team's capacity to continually improve every day. Thank you for the opportunity to learn rapid cycle learning. We enjoyed this process, and we are a better organization as a result of rapid cycle learning. Thank you so kindly.
Thank you so much, Frederick. That's wonderful to hear from you. So, and a big thanks also to Stephanie and Latoria, to Carl, and to Simone as well. We have time for maybe just one question for our last group of presenters. If folks have one, please feel free to pop it into the chat. I was reflecting, listening to you, a number of you spoke about how you're kind of spreading the word about rapid cycle learning to partners, to other departments within your organization. And I'm curious to hear what's been resonating with people when you talk about rapid cycle learning to other audiences, whether that's internal to your organization or external.
Can answer. I think one of the things is that the excitement of that if something's not working, you can change it. Like you don't have to sit there and keep doing the same thing and knowing, okay, the results aren't changing, nothing's changing. Like, you know, not being afraid to like, okay, let's revamp it. You know, we're going to go back to and that's kind of what we're going to do in January. We're going to go back to the drawing board and tweak some things that we've learned over the last few months with some of our testing. So I love that. I love that, you know, if it's not working, you know, change it.
Yes, yes, well said, Stephanie. And I think that reflects what we've heard from folks throughout these presentations, right? There's a lot of freedom in being able to abandon something if it's not working, change something if it's not working, really kind of learn as you go and make new decisions. Okay. Well, I would love to invite everybody to just give all of our wonderful presenters a round of applause if you'd like to. Wonderful job today. Thank you so much for telling us about your work. It was a real pleasure. So with that, I'm going to turn it back over to Renika, who has a few closing words.
Yes, thank you, Rachel, and thank you, grant recipients, for your work and for the efforts you're undertaking using rapid cycle learning to improve lives and communities, and for sharing that with us today. I also want to thank you, Rachel, as well as the Mathematica team for your strong leadership and supporting the grant recipients in using RCL techniques to be able to strengthen and enhance their projects. And additionally, attendees, thank you. You showed up today to support your colleagues. So thank you for that. And I hope you found the information meaningful, especially as it relates to your own projects and your programs, and how, thinking strategically about, and futuristically about how you could potentially use RCL to deal with some of the challenges that you may be having. Please note, I noted this in the chat, but just as a reminder, the information presented today, which includes the webinar recording, as well as the presentation and the posters, will be available on the OCF's website. We will provide information to the CSBG network when the materials are available, so please look out for that. And also for the future, we will be publishing tools and resources about RCL in 2023, so also look out for communication about that. So again, thank you, everyone, and I will now pass the mic over to Charisse, who will be providing final comments.
Thank you, Renika. Before I make any comments, I want to know if Dr. Howard or if our Deputy Director, Janelle Georges, are on the call. and to see if they have any feedback. Okay, I get to take all this time, the next 1 minute, because I could say so many great things about the work that you all have been able to accomplish in regards to the grant recipients. But I think you're all stars, so you may need to get ready to get a lot of questions and people reaching out to you to learn more about this work and how it has added value to your work and to your community. And what I just have like 3 main points that I want to make. First of all, it was so impressive to hear you talk about how you really focused a lot of your work to be family-centered and how you use, 2Gen and the whole family to kind of ground your thinking on how to improve outcomes for families as they strive to reach self-sufficiency and make sure their needs are met. I thought it was great to hear how you talked about your organization's changed and recognize that small increments of change over time is important and that you don't have to try to solve all the problems at once. But being flexible and agile, you're willing to kind of take it step by step to be able to get improved outcomes for the individuals that you serve. And I know for sure if you're a part of the CSBG network, you know data-informed decision-making is a big part of what we do. And so trying to figure out and what you shared and how you share data to make decisions, how you collect data to make decisions, how you use surveys, how you use focus groups. It was very impressive to hear some of those activities that you participated in to really keep your projects on track. The service areas, you talked about domestic violence, mental and behavioral health, responding to food insecurity. Amazing what you've all been able to do. And I could go on and on and on. So I don't mean to miss anyone as much as say that it's so much that you've been able to do. And then the value added by participating in the Rapid Cycle Learning Project and how you're going to use that information and transfer that knowledge to continue to build your organization. And then Ronika Carr has provided great leadership, so I want to thank Ronika. I also want to thank the Mathematica team. The coaching and how they've supported this project has been remarkable. And just stay tuned because we're going to be putting more information out about the great work. And thank you to all of our grant recipients for saying we need to continue work like this because we want to make us, we'll be able to share with our leadership the impact that this work has had on your organization, on the communities that you serve, and perhaps there will be future opportunities to continue this work in the future. So thank you for this community of learning. In regards to the Rapid Cycle grant recipients, we wish you the best, and we'll be in contact with you as we continue to move this work forward, but thank you so much. And I think that ends it. Oh, we had more than 100 attendees on this conference, so folks want to know what you're doing. So I think it's important for you all to know that as well.
Thank you, everyone, and have a great day.
Thank you.
Thanks.
Take care, everyone.
Thank you all so much. Take care.